one of the things that I struggle with when I'm working with people who are so movement minded and so smart in this arena already, and you know, you're going to be one of my colleagues very shortly, is we want to be careful with the terminology and the verbiage that we use with our patients. Because what we want to do is we want to create an environment where they feel empowered and give them tools that will help them without at the same time giving them verbiage and thoughts and pictures that make them feel like they are broken.
Yeah.
Does that make sense? So first of all, I don't think you're broken. And yeah, and some of the things that I saw are things that we see all the time. And oftentimes these are things that I see with endurance athletes. So I don't want to take away from your unique specialness, but this presentation is pretty consistent with the norm, all right?
Okay.
So if I had to give you an idea of what I think may be going on at this time, is we probably either have IT band tendonitis, like insertional tendonitis there, or it might be coming in a little bit to the patella tendon as well, right? So that's probably what would be the quote diagnosis in a case like this. But that also doesn't, and one of the things we're going to learn in this class is that doesn't necessarily tell us what we're going to do for it, okay? So the picture that I like to give people is thinking about your tissue's tolerance. So your tissue's tolerance to pressure, tension, load, weight, whatever it might be, your tissue has a level of tolerance before it's going to start. There's multiple ways we can think about it. Breaking down, like that would be the most severe, right? Where we're actually tearing tissues. But also before it becomes sensitive, meaning it creates symptoms for you. So just because you have symptoms does not mean that the tissue is tearing, breaking, things like that. We could just be at that load tolerance level where your tissues are now sending a signal to the brain saying this is how much we're being loaded, and your brain computes that as this is too much for me. And so the brain sends down the pain, right? Yeah. So what we have to do to fix these things or to create that environment where you can load it without concern of, you know, inability to perform or the actual like damage down the line, right? What we have to do is we have to find ways to decrease the amount of load that we're putting on the tissue, which you've already done. So you've already done step one, or one component of it, right? You've addressed how much load we're loading the tissues. What we have to do is we have to, so that's one thing. So the load coming up, there's like a graph, which you can't see my hands right now, can you?
No.
Okay, so there's a load tension tolerance graph that I'll show in class on Monday, or in lab on Monday. And you have managed the load, and you've actually been really successful with it. Would you agree? Yeah. I think that is brilliant. So you've already figured out how to decrease the load. What we get to do is we have to figure out how to increase your capacity. So we need more area under the capacity curve so you can increase the load so that you can do the training that you want to do, right? So that's where getting the nerdy brains together will benefit you, is we can not only decrease the load to make your issues more manageable, but we're going to figure out how to increase your capacity so that we can get load back to normal, and then even potentially take it onwards and upwards so that you can get into the half Ironman realm. Make sense?
Yeah.
Okay, so I'm actually going to wrap us up here. This is actually a great example of what a good first visit would be. I've learned a ton. Now, we haven't done anything as far as interventions go. So if this was a patient scenario, that the number one focus for me as the provider in that scenario is to instill hope and a plan, right? So if this is my endpoint and I go, look, I've got some great information, what we're gonna do is we have a different scenario where I'm gonna demonstrate this to your class. But if this was in my office, the way I would wrap this up right now is I would tell you, look, I've gotten awesome information. I have seen this before. I've managed this before. What I'm gonna do with this information is I'm gonna sit down and I'm gonna create a plan for you so that when you come back in, quote, quote, come back in, when we meet again, I've got things right off of the bat that we're gonna get to that I think are gonna help us increase that capacity so that we can get back to loading you regularly and then pushing the envelope. that make sense?
Yeah.
Do you have any questions for me?
Not at this time.
Okay, so let's pick this up on Monday. This is going to be a fun one. I'm excited.